right, good morning. As always, it's good to see you on My Doctor. How are you doing on this beautiful Tuesday? As always, thank you so much for joining us on My Doctor. My name is Winnie Lubembe. Now, musculoskeletal conditions are the leading causes of mobility and disability, and of course, giving rise to enormous healthcare expenditures and loss of work as well. And of course, they comprise of over 150 diseases and syndromes, which are usually progressive and associated with pain. And of course, they can broadly be categorized as joint diseases, physical disabilities, spinal disorders, and conditions resulting from trauma. So today we want to focus on one particular musculoskeletal condition, and that is on arthritis. And I know this is not new. We've heard, so many cases of arthritis. We know, or probably we could be knowing a friend or a family member who has arthritis. And of course, if you have had an experience with arthritis, then you know at times it's very, very difficult and very painful. But what brings about arthritis? Well, we have that and much more on our discussion today. You want to stick around till the end of the show and get to understand more on arthritis. And of course, to help us get more info on the same, I am joined by Henry Opondo, who is a chief physiotherapist at the current hospital. Good morning.
Morning to you, Winnie.
It's good to see you.
Nice
and
meeting you.
Thank you so much for making time for us today on My Doctor. And, talking about musculoskeletal conditions, this seems like a really huge and such a broad term. But can we just make it simpler a little bit, and then we'll now go to arthritis?
Musculoskeletal.
Yes.
When we talk of musculoskeletal, we are talking of the body parts that involve your bones, that involve your muscles, in simple terms.
All right. Okay, and of course, arthritis being one of them, because we're talking about
Exactly.
it being one of the conditions of the joint. So then, what exactly is it? Because you see, when we talk about arthritis, I'm pretty sure we all have our own definitions of the same, and we all have, the reasons why it comes about, which at times might not be true. At times, it's more of a myth than the truth. So then, when we talk about arthritis, what is it? And is it broad, or is it just refers to one specific condition, and that is of the joints?
Thank you, Winnie. When we talk of arthritis, in the books, medically, it means inflammation of the joint.
All right.
But what does this mean? How I find it easy to explain to an non-medical person is take an example. As men, we do socks with shoes most of the time, especially weekdays, official days.
Yeah.
So, for example, if you wear one socks throughout,
so the entire, oh wow, okay.
Okay, you will start to notice that there are areas of the socks that start to wear. Okay?
All right.
It could be the heels. Maybe you're putting so much pressure on your heels. It could be on the toes. Maybe you have got long nails.
Heel,
okay? So you'll start to see the socks wearing off. That is the same thing with arthritis.
All right.
When you talk of arthritis, we are talking of a joint. And inside the joint, there's something called a cartilage, which is the same as a socks. It's supposed to surround, to enclose the joint, to give it smoothness as you move. Just the same with socks. Okay? It protects your skin from the shoes. Okay?
Yeah.
So over a period of time, as we walk, we function, the cartilage wears off. Just the same way the socks wears off. Now, this wearing of the socks is the same as the wearing of the cartilage in the joint. That's what we mean by arthritis.
All right. Okay. So then, if that is the case, some of might think, then this is more of a condition for the older people. All right? Because, again, they've lived for quite a long time, done a lot of walking as compared to a younger person or a child. Then, of course, the first thing that comes to mind is that this is a disease of the older person. Is that true?
I'll say no. Currently, we can't say arthritis is only for the older people. No.
Okay.
Okay? We get, and this one now we can look into different types
all right.
of arthritis.
Okay.
this arthritis that, yes, is associated with old age.
Old age.
Okay? And this one is what we call degenerative arthritis.
All right.
Where the cartilages break down over a period of time. But still, even the degenerative arthritis, we still get it in younger people. For example, sports. Okay? So we understand how arthritis come. I've said that degeneration, the wearing off of the cartilage. Yeah. Now, in sports, how can we get it? Like high impact sports, soccer, rugby, these sports that require a lot of energy, force, okay? Jumping, things like that. Yeah. So one of the ways that you can actually make your cartilage wears faster is if you had an injury. Okay. All right. Okay? Then now the recovery period or the recovery mechanism was not successful. Yeah. You've heard of someone sustaining a knee injury, then instead of following the doctor's advice, it reaches a point they discharge themselves. Okay. Yeah. Yes. Okay. You say, I'm okay, I'm resuming. That predisposes you to injure your cartilage more faster than the other person who followed the due care. That will cause degenerative arthritis. Okay. So not only we see that in old age, but we see also in younger ages. Okay. All right. And talking of the same, I mean, of course, we have the different types like you talked about, because I was about to tell you, okay, fine. So that degenerative aspect here, of course, those people who get involved in like intense sports, and of course, the example that you've given. A good friend of mine has had arthritis for quite some time, I would say, and for her, it's not like she's very sporty and all those things. It just, we don't even know how it happened, because one time she just started feeling pain on the joint and all those things, and then by the time she was diagnosed, we found out it was arthritis. And at that time she was pretty young. I mean, I think she was in her early 20s, like 21, 22. Or thereabout, all right? So then, does it mean that, of course, this is like a particular or a different type of arthritis, or what? Can we look at the other different types, aside from the degenerative? Yeah. So apart from degenerative, the other types, there's another category that is called inflammatory arthritis. Okay? Inflammation. It's just an umbrella term. So let's see how this comes. Now, another good way I want to explain this is a dog. All right. We know a dog. A dog is supposed to provide security at home, meaning the dog should know he is part of family, the owner, the people who are in that home, in the home, and the intruders. So when the intruders come, the dog is supposed to back, okay? And if possible, actually even chase them away. Yes. That is the function of a dog. All right. But you've had rare occasions or situations where the dog actually turns against the people at the home. True. And kill the owner. Yes. Okay? Yeah. That is almost the same as inflammatory arthritis. All right. Whereby your immune body system, instead of protecting you against diseases, instead of protecting you against pathogens, it attacks you. Okay. And do you do something to sort of trigger that, or it just happens? Yes. The scientists believe it's a combination of environmental factors against specific types of genes in an individual. All yes. Right. Okay. So there's some genetic abnormality that if it's predisposed to certain environmental factors, it causes an autoimmune disorder. All right. A good example of an environmental factor is active smoking. Okay. If you smoke and you have that abnormal genetical mutation, you are at a risk of your immune system, instead of protecting you, it attacks you. All right. Okay. And is it only on smoking? Because we see so many people smoking. And even before that, then how do you know that you have that specific gene that, if predisposed to a certain environmental condition, then of course triggers your immune system to start, fighting against you? How do you know then, so that we avoid? Because most of the time people don't know. I mean, and is it like
any other condition where you would say, oh, my grandfather had it, and then let's say my dad or my mom, and then a family member in us has it, and then I am sort of predisposed to the same.
One of the factors that you need to really take into consideration, because you won't tell the whole Kenyans to go for genetical screening,
True.
okay? But there's what we call family history.
Yeah.
Okay?
All right.
If one of your family member, your father or your dad, okay, had a history of arthritis.
Okay.
Arthritis can be genetical.
Yeah.
Okay? So if one of your relatives have it, you're at a risk of getting arthritis.
Okay.
Now what you need to monitor is your lifestyle, your environment.
Okay. Is that dependent though on the type? Because remember we talked about the degenerative, and then of course now we're talking about the inflammatory. So whatever form of arthritis, it's just important to be on the know on the type, so that you know if you're predisposed or not.
If you look at degenerative and inflammatory, yes,
okay,
you are at a risk of getting it.
Okay.
If one of your relatives
had it
in the history.
All right. And then aside from smoking, any other thing that triggers the immune system to fight against?
How generous you are with your foods.
Okay.
That make you go beyond the normal weight that the body can sustain.
Yeah.
Okay? So we are looking at obesity. Okay? Too much weight in the joint. That will cause more pressure on your cartilages, and so they are at a high risk of wearing off. Other factors like activities of daily living, sedentary life. Sedentary life also has a predisposing factor to you acquiring arthritis.
How so then? Because this is sedentary. I mean, someone is not as active as compared to this other person who's actively involved in sports that are very, very intense, or walking a lot, or doing all those things. Them, they're just sedentary, all right? So then how are they predisposed to getting arthritis?
Yeah, so a good example is we don't want to move our joints beyond. So you wake up in the morning, you take shower in a standing position.
All right.
Not till, you remember how we, long time ago, you use a bucket and you have to squat. Now, if you look at the squatting in itself, if you look at the range of motion taking place in your hip, how far your hip is moving, how far your knee is moving, how far your ankle is moving, in itself is a good exercises, okay? From there, take breakfast, maybe an Uber or a vehicle come there, or a boda boda, taxi come, take you to the job, okay? You won't say there's much movement there. Go to work, your focus is my work. And most of the work nowadays, because of technology, where you are, you can do a million things.
Yeah, true.
Okay?
You're right.
You only move when maybe you want to go for call of nature, or you want to go and eat. Sometimes actually they are served food there. You actually
eat,
okay? So we're actually decreasing functionality, movement. So what happens is that joints get nutrients, cartilages get nutrients when they are mobile, when they move. There's what we call synovial fluid. It is produced, it is distributed in the joint when there's movement. When there's
movement, all right, okay. All right, so if you're not then sort of making good use of it, then
yes, so when there's less movement, you are actually depriving your cartilages of nutrients. And so they're at high risk of breaking.
Okay, makes sense. Because you see, of course, given the definition that we talked about, that is the aspect of wear and tear, we think, oh, well, but if I'm seated or if I'm not as active, then I'm protecting my joints, but in real sense, you're not. You're actually exposing them to arthritis.
Yes.
Okay, and then there's also an aspect of infectious. We have metabolic and rheumatic. Can you talk about those different types?
So rheumatic is we still classify it under inflammatory arthritis, rheumatoid arthritis.
Okay.
Okay. Yes. So we have infectious arthritis. Now it can be as a result of bacterial or viral or fungal infection to the joint. Okay. Very rare cases do you get an infection because of a procedure that has been undertaken on your joint because of the aseptic techniques that are now easily available in the hospital.
All right.
But there are other things that can predispose us to these organisms getting infection. A good example is contaminated food.
Okay,
Which
we are all exposed to almost all the time.
Yeah. You can pick a bacterial infection there that goes affect your joint.
Yeah.
Okay?
Yeah.
Gonorrhea can actually lead to a joint infection. Hepatitis, this blood-to-blood infection, can also lead to a joint infection. So when we talk of infectious arthritis, we are looking at infection, bacterial, viral, or fungal infection to the joint.
Okay.
The other one you mentioned was...
All right. We have the metabolic.
Metabolic. Yes. So metabolic, to the public, for you to understand
to understand better, yes.
It's something to do with the uric acid. Okay? It is too much in the body that it's not reabsorbed.
Okay.
So it ends up being deposited in the joint. And when it deposited in the joint, it comes like a crystal. Okay?
All right.
Sharp crystal. It's like a stone, but sharp stone in the joint that actually pyres you, okay? Pinches you on that joint. That's what we call metabolic arthritis.
Yeah.
There are people that has a very few percentage that has got abnormal uric acid retention in the body.
All right.
But we've seen most of the people who take this social or commercial food, like the few people who every night they have to fight with the alcohol.
Yeah. Okay.
Okay.
All right.
They're at a high risk,
of
getting excess uric acid deposited in the joint. In the joint. That's what we call metabolic arthritis.
Okay. All right. So then, among all this, the different types that we've talked about, which one is more common? And then I understand we have like 3 minutes to go on a break, and I think we'll come back and talk about the symptoms. Then, so how do you know which type of arthritis you have, depending on the symptoms that you have? But before that, which is like more common that you deal with?
The most common is degenerative arthritis.
All right.
And degenerative arthritis, we are looking at osteoarthritis, arthritis involving now the bones. And we majorly see hip in male and knee in females.
Okay.
Yes.
Why is that? Do we know why, or it just happens? The aspect of hip and knee between the male and the female.
Yes. So for female on the knees, biomechanically, is that women has got broader hips than
men, true.
Okay? Although you'll get, like me, I got some hips, but anyway. So, so when you got broader hips, it causes more pressure or malalignment on your knee.
Okay. Makes sense.
Okay? And so we are starting to get excessive or abnormal pressure on the knee joint, on the cartilages. Now that is leading to wear and tear.
Okay. All right. So let's take that very short break. But of course, when we come back, we still have a lot to discuss as far as arthritis is concerned. And of course, one of them are the signs and symptoms. And of course, who gets arthritis? We talked about older age. But again, we see a number of young people also getting cases of arthritis. But if you have any question in relation to today's topic that is on arthritis, then feel free to call us live or 0791-478990, or alternatively send us a text message on 40920. We'll be looking at your questions as soon as we get them. But in the meantime, see you after this very short break. Right, welcome back. Glad you're still with us. This is My Doctor. And just in case you're tuning in right now, our focus today is on arthritis. And like we said, arthritis is pretty much, we've seen a number of cases on the same, and probably you know someone who has, let's say, arthritis or had arthritis. And if you're not so sure what brings about arthritis and, what are some of the symptoms for the same, what should you do to prevent it, then remember we're live. So that means you can call in any time with your question. The number to call through is 0791-478990. And of course, we'll be answering your questions. And on that note, we have a caller on the line. Good morning. Good morning.
Yeah.
Hi, thank you so much for calling us. Do you have a question?
All right. I was saying that I went to the hospital having the pain on above the hip of the right leg. After X-ray,
okay,
I was told that or the clinic officer suggested that it looked like arthritis.
Okay.
But my problem was chlamydia-like.
Can it?
Chlamydia. Where I had pain on that part.
Okay.
One of the tests was also paining.
Uh-huh.
And my urine was a little bit greenish.
Okay.
Yeah, I would like the advice from the doctor.
All right. So, so your question is, could it be something else and not arthritis? Oh, okay. All right. The caller has dropped, but I hope we pretty much got what he was asking. He went to a hospital, the hip on the right leg, of course, the aspect of pain, and then after an X-ray, the clinical officer said it could be arthritis. Of course, the aspect of strain on the back and greenish urine. What could it be, or is it a sign of arthritis?
To diagnose arthritis, normally there are two elements we are looking at. We are looking at an objective examination and subjective examination.
All right.
Subjective examination is what will lead to objective examination. What do I mean by subjective examination?
All right.
I mean, what is the clinical presentation the patient has?
Okay.
The signs and symptoms. One of the signs of arthritis, early signs of arthritis, is pain. Okay?
All right.
Pain with weight bearing. Okay? If it's the hip, they don't want to stand on it for so long.
Okay.
Okay? So standing might give them pain, and when they stop standing or when they walk, the pain reduces.
Okay.
That starts to ring bells,
All right.
like features of arthritis. Number two, there could be swelling. Okay? Either the hip, the joint that's affected, you'll see there's an increase in mass as opposed to the other side.
The other. All right.
Okay? Number three, there could be warmth on the skin. You feel like my right knee is hotter than the other side.
Okay.
Okay? That tells you there's some inflammation process going on.
All right.
Number four, it's time of the day that they complain. Normally they will complain first thing in the morning.
Okay.
Gets a little bit better in the course of the day because of some movement.
Activities, yeah.
And probably later in the evening when now they're also shutting down. Okay? Those are clinical signs that start to make you think there could be arthritis going on here.
Okay.
Okay? Then from there, the clinician, the simplest investigative mechanism is an X-ray department.
Okay.
Okay? That you can come to current hospital, anytime.
Right.
We get an X-ray. Depending on the clinical presentations you have, then we can be able to start saying, yes, this is arthritis. It could be an early sign of arthritis. Okay?
All right.
There are other features that might trigger the clinician to order for other tests. Probably they want to screen your blood and see the inflammatory markers, or they want to test for urine and see maybe things to do with the metabolic or gout and so forth.
Yeah.
Yes.
All right.
So if my friend has got those four clinical features, then he should start thinking, this sounds like arthritis.
Yeah.
Okay? But of importance is that arthritis is not a sudden onset of complaint of symptoms.
All right.
It's gradual complaints,
Okay.
gradual but progressive.
Okay.
Yes.
All right. But he also talked about an aspect of greenish urine, and then either he talked about pain in the back or strain. I didn't quite get that aspect. But then again, because he went to hospital, and of course the clinical officer was like, this could be arthritis. So what does the greenish urine then mean?
Well, it could mean a lot of things,
All right.
okay?
All right.
But you cannot isolately say a greenish urine
Definitely equals arthritis.
Okay.
All right. All right.
There are many other factors that can cause changes in color of your urine.
Okay. All
So
right.
that itself cannot be an indicator that I could be having arthritis.
Arthritis, okay.
But he talked of a strain on his back and so forth. Possible if you have pain in the hip.
On the hip, yeah.
Naturally, the body will want to protect that part.
Yeah.
Okay? By that protection, if I step on your big toe now, okay, probably you want to walk without this shoe and with the toe lifted up, like you're minimizing weight on it. So probably my friend could be having the truly hip pain, and so he start to compensate. Okay, that will lead to strain either to the knee or to the joint, to the upper back, to the lower back. I mean.
All right.
So normally when you try to limit this joint, the joint below and the joint above will bear most of the weight. So any complaint can come.
All right. And then you're talking about an aspect of pain. Is it on and off? Or is it consistent? Because you see, most of us, I mean, you feel pain, of course, the first thing that comes to mind is go get a painkiller, and then that's it, all right? Or then the aspect of, let's say, so for pain mostly, is it on and off, or is it consistent?
Great. Early signs of osteoarthritis, it will be on and off.
All right.
It will come and go.
Okay.
It will be episodic, okay? You might tend to feel it when you're too busy or when it's too cold.
Yeah.
Okay? But what I always say, pain is good.
Okay. Oh, yeah.
Pain means you're still alive.
Yes.
And pain tells you something is not right. Okay? So when you go and buy the painkiller by yourself, you're actually treating the pain. You're not treating the cause of the pain. It will be good to find the cause of the pain as you self-medicate. Okay? But what you should also know, it's good to take painkillers, but seek a clinician. Go and come to the hospital and find out what is causing this pain.
The pain,
yes, very important.
Okay.
Sometimes you might come and just say it's just a simple back pain. Okay? And maybe a clinician says, let me just order an X-ray. And you say, no, let me just go and buy Panadols. No, it's trying to establish what is causing this pain.
Okay. All right. And then we also have another question on our SMS line. This one says, I have something hard developing in the joint of my right hand, the finger next to my small finger. That's it. All right. So we don't know what they really want to know, whether it could be a sign of arthritis or, but can we just tackle this aspect of something hard developing on the joint of my right hand? That is the finger next to the small finger. Yeah. They have pain on I mean, something hard.
Okay. Great. So we know arthritis can cause certain signs of deformity in the fingers, like knobbing of the finger, okay? That could be an early sign of osteoarthritis. But to me, of importance is the presentation. If that thing hard on the hand, okay, is it causing some pain?
Pain, all right.
Is it affecting activities, okay? Then you start to associate it with the mechanical, like it's a mechanical, it's a joint issue going on. Sometimes it's not also good to assume that that thing that is swollen there is arthritis, so it's not giving me pain, let me assume it. No, it could be a growth. So it's good to seek clinical
medical
examination.
Okay,
yes.
All right, don't just self-diagnose or self-medicate.
Exactly.
All right, okay, so keep calling us. The number is 0791-478990. That is if you have a question or a comment, or you just want a clarification on the topic, and that is on arthritis, or better yet, if the lines are busy, then send a text message on 40920, and of course, we'll be answering your questions as soon as we get them. And please complete your questions so that we give a comprehensive answer on the same. All right, and then another question on arthritis would be then, so does it affect mostly one joint, or it could be multiple joints? Like, can one have arthritis, let's say, on the hip and the knee or the hands? Yeah, so does it affect only one specific joint, or it can affect multiple joints at the same time?
Depends. Osteoarthritis or degenerative arthritis, most of the time start with one joint, but it can progress to bilateral, maybe this right knee and left knee.
All right.
Inflammatory arthritis can affect two joints at the same time.
Okay. Wait, so and especially for degenerative. So then what brings about, or what causes then it to,
affect one joint?
Yes.
Why should it start with one joint
and then
the other one?
To the other
or
one.
why did it need to start with the left and went to the right?
Yes.
Yeah. So that's a very good one. Have you, I don't know whether have you ever seen people or a person who went to the shop, bought a shoes from Bata. he or herself wear these shoes, but they wear unevenly, not equally. Ukiangalia mguu ya right imeisha kuliko the left one, but it's only one person who's been putting it on. And he walks with the legs at the same time. Okay? So we tend to get some dominance in the body parts, or in the body sides. Okay? You could be dominant more to the right side than to the left side. Okay? Take, for example, a cleric officer who, apart from typing, has to receive phone calls and so forth. So because of multitasking, they want to receive the phone call with the neck, like this, as they continue to type. Okay? And probably this information they are getting from the call is what they are typing here. And this happens, let's say, 6 to 8 hours in a day. You start to get more compression on this side.
One side,
You get that? So we're just looking on how lifestyle you can lead to imbalance of the body parts. You get that? You're so dominant in the one side than the other. The side that is more dominant will have more pressure than the other side. And so that will bring degeneration. Okay? If you don't correct it, if you don't go for wellness, physiotherapy, wellness. Yes.
But we don't do that. I mean, as a country, we don't. We only go to the hospital when
you're in pain.
In pain. And that is like complete pain. When, let's say, you have tried to take painkiller and then it's not working, that is when we go to the hospital. And I think that is a really, really bad culture that we need to...
And that's why, Winnie, you are doing this show, so that you can enlighten the society that don't wait until you are in pain. Okay?
All right.
A good example is when you want to travel up country. Okay? Do you wait until you get a flat tire or until the brakes comes off? You go for regular maintenance and servicing of your car. Okay? You don't wait until it literally breaks down. Is when now you call for mechanics. Why can't you do the same to our body? Come to Karen Hospital for checkup. And we have got this wellness checkup. Cutting across the entire body, from mental, spiritual, biological.
Spiritual, all right. Okay, all right. And then we also have had cases of people say, I have cracking and popping, all right, on the joints, whatever part of it. Could this be an early sign of arthritis?
So cracking like this?
Yes. And the aspects of popping where, and especially, and again, I see this in, say, let's say older people, where when they want to stand or sit, then you hear that aspect of popping and cracking, all right? So could that be a sign of arthritis?
Yes and no.
Okay.
Okay?
Can you start with the no?
I start with the no.
Yes.
Yeah. So cracking, the noise, there's a crack in the body, in the joint. It's like a pop-up sound, okay? Of just the gaseous, the synovial fluid, when you start for long and you want to mobilize that part, you pop it and you feel like you have been re-energized. That is really not arthritis. Okay?
And that's a good thing.
It's a good thing. It's a good thing. It's only a bad thing, okay? If you make those noise when you're moving, they are painful, or they're limiting the degree of your movement.
All right.
Okay? So for example, I want to stand up. You've seen people, you've heard of people when they stand up, their noise make some sound. Their knees make some sounds. Okay? And the way they wake up, okay, is like they're struggling. Okay? Like this. And it's making noise. That tells you there's no smooth movement in the joint. But if you just make noise and you're fine, you're able to move your joint, you're able to flex, you can squat, you can do another thing, it's not a sign of arthritis.
Okay.
Yes.
All right. Okay, that is on the good part.
Yes.
I mean,
I've combined it.
Bad. Yeah.
I've actually combined it.
Okay.
So it will be bad if it affects your activity.
Your activity, yeah.
Okay? The ability to move, to do to complete a task. If it brings pain.
Pain, yeah. Pain is like the primary sign of arthritis.
Exactly.
All right. Okay. We have a question here. This one says, hi, I have burning sensation, kudungwa-dungwa, under my feet, and it has been long. I went to a hospital and I was told it is uric acid. Could it be arthritis?
Possible, possible. Those are some of now the side effects. It's possible. So Arthritis, yes. Rarely do we get, when we talk of kudungwa-dungwa, amesema kudungwa-dungwa, pain, yes. Burning. Now, that kind of pain is coming from a structure that is called nerve. It's now the nerve that is irritated, okay? So we just need to find out from which area, from which root is the irritation coming from. You get that? Arthritis can affect, and it affects the spine as well, okay? And in the spine, on the vertebra, we have got what we call the nerves that supplies the legs. At the neck, it supplies the hand, okay? So you can get degenerative changes in your neck that is triggering impingement of nerves. Kudungwa-dungwa inakuja kwa mkono. Same, you can get it on the lower back, okay? Causing signals, numbness, paresthesia, kudungwa-dungwa kwa mguu. So that's possible. All right. Okay? It could be a complication of degenerative or arthritis.
Okay.
Yes.
All right. So then what could they do? Because what they're saying is they were just told it could be, I mean, it was uric acid. Are there things that they can do to sort of then bring it down, and that is the aspect of uric acid, or just do away with it completely?
Yeah, so once they have been told that it's an issue with the uric acid, meaning that from their side, and I hope they were taught, is they really need to watch their intake, whatever they take. All right. Okay? Once you've been diagnosed with some of these, like uric acid issues or arthritis and so forth, you need to watch the antioxidants food that you take. Okay? Processed meat, processed food, high intake of meat and so forth. You need to monitor or regulate or minimize or just avoid them. Okay? Completely. And take vegetables, herbs and so forth. All right. Okay? And that is something they can do on their side. Number two is also they need to be active, physically active. Okay? All right. Because you know the muscles, ideally it's supposed to help you move, but they also regulate the weight that goes to your joint. Okay? A good example is when you're walking downstairs, okay? One or twice or many times you've missed a stairs, okay? And stepped on the stairs with maybe an inverted, with a bent foot. You get that? Yeah. Now, there are cases that probably you step like that and it did not stop you or it did not prompt you to go to the hospital. Yeah. There are cases you might have stepped like that and you didn't step again, probably after another 3 months. The difference is that the amount of weight that was there, if it was on a strong muscles, okay, the muscle tried to contain the weight. So that it doesn't go and start destroying the joint. Yeah. So in arthritis, the same. If you don't have strength in your muscles, then the little weight you have just collapse on the joints, on the bones. So you feel like you're knocking on each bones, and that is painful. That's why they are advised. We advise them, remain active. Get strengthening exercises. And these strengthening exercises are not universal. Okay? It is tailor-made to individual need. Okay? So don't go to the YouTube and see this, or your friends told you, oh, yeah, I did this and it worked. No, it's tailor-made to your
for
needs.
An individual. All right. And then, and talking about weight, I'm really, really concerned, especially for children. Like we see so many cases of children, very young, but most of them are overweight or obese. Does this put them then at a higher risk of developing, let's say, arthritis later on?
100%. Yes. Yes. Overweight has no mercy on your joint. That is the truth. Okay? All right. That is the truth. So a very easy way of understanding the amount of weight that your joint can take is take your height. All right. Your height in centimeters. Okay? Less 100. 100 is constant. The value you get, play with it. That is your value. That's what you're supposed to survive in terms of the weight.
Okay. So do not...
So if you are 200 centimeters tall, less 100, that will be 100. please. The moment
Never
you go above 100,
yeah.
you start to strain your joints.
All right. That is pretty easy because most of us rely on BMI and sometimes we don't know BMI and all those things. So that's pretty easy. Your weight less 100 and then that's it. Oh, I mean your height. Your height.
Less 100.
Yes, less 100. Okay. And then again, people mostly say the arthritis affects women mostly as compared to the men. Is this true? Or it's one of the very many myths that we're looking at as far as arthritis is concerned?
Slightly true.
Okay, all right.
The thing is that if we have 4 women, there's high chance that one of them will be arthritic.
We'll have, okay.
And if you have 5 men,
yeah.
one of them will be arthritic. So it's 1 to 4 in women and
yeah.
1 to 5 in men.
In men, all right.
Okay? But there are things that predispose women to arthritis
as compared to
men.
The men, all right, okay.
Okay? One of them is the hormonal changes. Estrogen, it protects you against inflammation. But the moment you wean it off, menopause, inflammation comes knocking.
All right.
Okay? Number 2 is what you don't like, obesity. Women are at a high risk of being obese, okay? Due to maybe hormonal, childbirth, and so forth, than men. And we all understand how that extra weight put pressure on your joint.
All right.
Another one is women are more active, okay? During childbirth, they do a lot of things on the hands, bending their knees, mopping, and so forth, okay? So if they do all these activities without wellness physiotherapy, they're at a risk of wearing off their joints.
Their joints, okay.
These things also, they contribute,
all
but
right.
yours is fine.
You.
Yours is fine. Lifestyle.
All right.
Yes,
yeah.
you really get tall,
yeah.
very high heels. High heels that even for them to walk up to that door,
yeah.
they have to calculate that movement.
The move, yes.
And you can tell that they really have to coordinate. Otherwise, you'll fall.
True.
That is a lot of pressure on the joint.
On the joint.
Yes.
All right. Okay. And then something else in terms of the intensity of arthritis, because like we said, it doesn't just come instantly. Of course, it's progressive. It takes time before you even notice some of the signs and symptoms that we talked about. So then are there things that sort of trigger the severity or the intensity of arthritis, whatever form it is?
Good. So when we talk of intensity, intensity and severity is different in these ways. Intensity is, when you want to define intensity, is you have arthritis. We have arthritis. So how fast does your symptoms comes on when you do aggravating factors? Aggravating factors are things that when you do, you get so much pain.
Pain, yeah.
Okay? So one of them we said weight-bearing activities, like long-standing, things like that. So severe or, okay, in terms of stages, a chronic osteoarthritis that is not managed, they have high intensity because they don't want to load the joint.
Yeah, true.
Okay? So you'll want to see them, if they want to stand on the chair, they want to use their hands as additional leg
to sort of support,
so them so that they minimize the weight.
All right.
When they walk, they want to use assistive devices like a walking frame, a crutch, and so forth.
Yeah.
Okay? That is intensity. Intensity is high on how long it has been, but more so if you have not been seeking intervention. If you've been doing self-medication, you increase the chronicity. Severity, when you talk of severity, is now the loss of function. Okay? Severity can be high or moderate. So loss of function is, for example, I'm a long-distance truck driver, and I've been diagnosed with arthritis of the back because of long sitting. Okay? High severity is when you cannot drive even up to town. Moderate severity is you can drive up to Nakuru, but you have to take a break.
You have to take a break, yes.
Now that's the severity.
All right.
Okay? And again, severity, intensity, they increases when you don't seek intervention, medical help early enough.
Okay. All right, which is something that we do, again, all the time, and it's completely wrong.
And some of the things we do, is universal exercises in the gym.
Okay.
Okay?
All right.
Because we told you exercise help reducing arthritis, kila mtu ameregister kwa gym.
Yes.
You want to exercise globally.
All right.
Not looking at what needs what.
What needs, yes.
Okay?
Yeah.
That can also be a mistake.
All right.
And we receive patients, we receive people from the gym.
Yeah.
Yes.
Who are really active and thinking they're maintaining an active and good lifestyle.
Yeah, so it's good to keep fit,
yeah.
but get a clinician, come for wellness checkup, and you have got a baseline that, you know what? Probably you need flexibility exercises for your upper back and strengthening exercises for your lower back.
Okay. We have a caller on the line. Collins from Roysambu. Good morning.
Yes, Winnie.
Thank you so much for calling us, Collins. Do you have a question?
Yes, I have a question for Dr.
Go ahead.
Yes, I wanted to ask him, apart from roasted meat,
All right.
what other diet can cause arthritis?
Okay, all right.
Yeah.
You're an avid eater of roast meat. All right, so roasted meat, aside from meat. And is it actually true? Because we hear so many cases of the same. If you take roasted meat, increases your chances of arthritis, kidney disease, all those things. All right. So yeah, aside from roasted meat, any other thing that can cause arthritis?
We are looking at, in a nutshell, we are looking at foods that will make you boom.
All right.
Okay? So don't stop roasted meat and go for high consumption of chips.
All right.
Okay?
Okay.
This oil, fatty foods, okay? That will cause extra adipose tissue, more fat in the body.
In the body, yeah.
Because that fat, the body will not use all of it, okay? The deposit, the part that is remaining will be deposited.
Okay.
It can be deposited on the joint, it can be deposited on your arteries. Okay? So we're not looking at only roast meat, we are looking at these foods that give you extra fats, sugars that you don't need.
Yeah.
Even alcohol, beer, has got extra calories that you don't need.
That you don't need, yeah. Okay. I see most people, especially who take beer, they'll say, you know, beer is much safer as compared to this other, you know, whiskey and all those things. Trying to defend that aspect, but no.
Yes.
Yeah.
It has got extra calories
Extra
that you don't need.
Yeah.
If they yes, beer has got that calorie that they need, but they just need to take a half a beer.
Okay.
Just half a beer.
All right.
And you'll see, you'll go to certain community, one beer, they buy one beer, they share two people.
They share two people too.
You've seen that?
Yeah.
And they call it a day.
Okay.
And you feel like, are these people serious? Yes, they are serious with their future.
Yes, they know what they're doing. All right. But generally, of course, we do not advise, you know, on taking alcohol and all those things.
To get a comprehensive list of, in terms of food, the do's and the don'ts. My friend from Roysambu, don't feel shy. Come to Current CBD in town. You'll find our nutritionist there. We'll give you a whole list on what you can do from Monday to Sunday.
Okay. All right. All right. And then let's say then someone has arthritis, whatever form, and they're watching us right now and thinking, okay, so then how do I manage in terms of either lifestyle, medication, and all those things? Because we have, looking at my watch, we have very limited time before we end the show. So then in terms of just management of arthritis, and does it have a cure?
No, there's no cure for arthritis.
Okay.
And especially degenerative arthritis, you like it, you don't like it, you'll get it in life. I'll get it in life. As a physiotherapist, I'll get it in life. A surgeon will get it in life. That's a must.
Okay.
Okay? It has no cure.
Okay.
But what we don't want is for it. Arthritis is one of the causes of disability in old age. Okay? So what we don't want is arthritis now to cause disability.
Disability,
okay? So there are modifiable factors, okay? Those risks that put you into getting arthritis, but you can work against them.
Yeah.
Obesity, okay? Watch what you eat. Very, very important.
Very important,
That is very, very important. Healthy life, walk, do exercises. Once in a year, okay? Go for physiotherapy.
Yeah.
Wellness check. Let them just scan through your body. See you, tell you your weight is more on this side, for example, okay? It can never be 100% equal,
true, yeah.
but there are certain components they can be able to help you fix.
Okay.
Okay?
All right.
So watch what you eat, do exercises. That is the most common ways of trying to minimize this risk. Okay? There are things you can't do about it, like age. Okay?
Yeah.
As long as you're alive, you will continue growing. So as you grow in age, you're at a risk of getting arthritis.
Right.
Genetics, you can't change it. If you're born in that lineage, it will remain there.
Yeah. All right. And then we have a question here. I think people are really, really concerned about the uric acid, because this one says, hello, what are the causes of high uric acid and the treatment, and can it cause arthritis?
Yes, it can cause arthritis.
Okay.
Okay?
Yeah.
One of the causes, so one of the causes is what we eat.
Okay. What do you mean? Because most of us don't really focus on the healthier lifestyle, but yeah, what do you mean what we eat? The unhealthy
habits.
Okay. All right.
What we consume. Okay? Is it necessary for our body system? Okay? And to what extent?
Okay. So just watch what you eat,
and
basically.
It's treatable.
All right.
Okay? But it's only treatable also when you change your lifestyle.
Okay.
A good example, which is out of here, is I have high blood pressure. The doctor has given me antihypertensive drugs. I've been told, don't take too much sugar, okay? But what I do, I go take nyama choma, put a lot of salt. After that, I take my antihypertensive drugs.
Yeah.
The following day, I go back to meat with sugar and salt, take my drugs.
It's not helping.
It's not helping.
It's not, yeah.
So we are looking at preventive is better than curative.
Yeah.
Okay, so it starts from us in the house before you come to the hospital.
Okay, all right. And in terms of the treatment, then very brief, what are we looking at in terms of the treatment?
So generally,
for arthritis.
So generally, the big number one goal is to relieve pain. Okay. Yeah. So pain relieving. Pharmacy, medicines, there are different drugs that helps in relieving pain. Okay. There are pain relievers. They also that also can also help you with contain inflammation. They are called anti-inflammatory.
Right.
But the worst thing you can do is to self-medicate, because again, these drugs, some of them are so strong and could be having some side effect. So yes, you could be knowing your features of arthritis. My humble request to the public, don't go and ask for ibuprofen on your own. Okay. Go for a clinical checkup, okay? Or go to a pharmacist, okay? And we'll be able to advise you accordingly. Yeah. So apart from pain medication, the drugs, physiotherapy play a very important part in terms of preventing further damage to your joint, because arthritis, it's progressive. Yeah. It never stopped that now degeneration has stopped. It only stopped probably when you're dead. Okay? So physiotherapy is quite important to help limit this degeneration that will cause disability. The last part, when the worst come now to the worst, severe, is now you go for surgery, where they have to give you a new bone, a new joint.
Yeah.
Yes.
And then, yeah, Ebru, take us through that, because then we've had people who say, I will go for it, but then again, how long will it last? Because see, it's not God-given. This is sort of like something new introduced into the body. Yeah, so how long does it last, and does it have sort of like complications, that come with it?
Yes, very true. Yeah, if you have a car and you replace the gearbox or the engine, it will serve you. It will serve you for, but still, you will have some issues.
Okay.
So how long you can survive post total hip replacement and so forth is depends on before you went to the surgery. How were you? Were your muscles active? Were you active? Okay. So we'd still need before you reach there, you need some pre-treatment.
All right.
What you eat, pain control, exercises, that will really, if you do that, then you have a longer capacity that after the replacement, you can still lead a very functional life. Right. But point be taken, when you have artificial knee, it will never be the same like the natural knee. True.
All right. And we have to end the show right now. Unfortunately, time really flies by. But thank you so much for coming by today. And of course, just helping us understand, more on arthritis and of course, ways to manage it. And most importantly is the preventive aspect of it, because we do not want you to get to this point where you have to go for surgery. We want you to prevent. So thank you so much for coming by today. That is Mr. Opondo from, Chief Physiotherapist at Karen Hospital. And I believe that you have been answered to your satisfaction. Thank you so much for keeping us company till the end of the show. We'll see you again tomorrow, same time, same place. And that is on My Doctor as we tackle another health topic that, of course, will help you make better health choices. Have yourselves a good one. See you tomorrow.